Hi everyone, I'm Ray and this is Florence. So this is the second video in a series of videos we're putting up onto our Facebook page. Today's video is going to be on the neck and the common conditions we see in practice and how it relates to headaches. Some of the most common conditions we see in the neck is facet joint inflammation, also known as facet joint syndrome, and cervical disc prolapse. So a facet joint inflammation is where the surface of the joint gets irritated. This causes the capsule of the joint to inflame and the muscles over the joint to go tight to stop the joint from moving. This commonly occurs in the top three segments of the cervical spine and the lower joints in the cervical spine. So when you get a joint inflammation in the lower cervical spine, this can commonly refer pain over the shoulder. So we get patients coming in complaining of shoulder pain, but there's no pain on shoulder movements. So this is more likely that the pain may be coming from the neck. To test this, if you side bend your head towards the pain, or bring the head back up, and rotate it towards the pain, it's likely to create a sharp pinching pain, and it will increase the symptoms potentially over the shoulder here. Okay, if I just turn Florence to the side, so the pain itself would refer over the shoulder to the tip of the shoulder, covering the shoulder blade and up towards the spine in that region there. If you were to side bend your head away or rotate your head away from the side of pain, that will create almost like a pulling or stretching sensation. A joint inflammation in the lower cervical spine can create pins and needles and weakness down the arm and pain down the arm, but it's less likely and less common. If you're getting pain down the arm below the elbow, it's more likely to be disc related than it is to be joint related. However, we can have a disc prolapse and a joint inflammation at the same time. So when looking at the symptoms of an upper cervical joint inflammation, it'll be very tender to touch the joints where the pain is located. Also, the joints will be restricted on rotation and side bend towards the pain, and it also reproduces the pain symptoms. Commonly as well, when we get these restrictions in the upper cervical spine, it can create something called a cervicogenic headache, which is a constant pain that occurs, if I get Florence to turn to the side, it occurs at the base of the spine, at the base of the skull, around the side of the skull, at the front of the head, and commonly around the eye as well. This can mimic something like a migraine type symptoms. However, with a migraine, it'd be more of a thumping, throbbing sensation, and you may have other symptoms like an aura, difficulty speaking, and symptoms into the arms. Whereas with a cervicogenic headache, it's more of a constant pain, which is made worse for neck movements. Another common type of headache we see in practice is the tension type of headache. We see good results by treating the tension type headache in clinic, generally by concentrating on the trapezius muscle and the suboccipital muscles. When doing this, we want to do soft tissue and stretching onto the trapezius muscle, which is this big bulky muscle that runs down the side of the neck and in between the shoulder blade and the spine. The suboccipital muscles are the top of the cervical spine and they attach to the base of the skull in this region here. So, cervical disc prolapses. So I have quite a few patients coming in and they're talking about their discs slipping. So discs don't actually slip, okay? So when we're looking at the discs, there's a hard collagen fibre on the outer surface of the disc that attaches to the vertebral bodies either side of that disc. Inside of the disc, there's almost like a jelly type substance. And when we get a disc prolapse, it's actually caused by a tear in the collagen fibres, commonly at the back, on the side. This is one of the weakest part of the disc. When there's a physical force applied down on the disc or there's a traumatic injury, that jelly type substance inside the disc pushes out through the tear and applies pressure onto the nerve, demonstrated by this red marker just here if you can see that. Of course, if it's occurring in the lower back, you're going to have symptoms of pins and needles, weakness and pain down the legs. Depending on what level is affected, it depends where the symptoms are going to be, and the same within the cervical spine. If we got a nerve being pushed into the cervical spine, you can have symptoms down the arm, and again, depending on the level, it's going to depend where them symptoms are. So in the acute phase of facet inflammation or cervical disc prolapse, the first thing I would do is ice the area. So I'd use an ice pack like this that moulds even when frozen, so I can really mould it around the structure. Obviously when we're icing, we have to wrap the ice pack in a tea towel or wrap the area of skin with a bit of clothing so we don't burn the skin. Okay. When we're looking at a facet irritation, really there's no point putting it over this bony aspect here, that is just bone. The joints in the neck are slightly onto the side, So if we're looking at a lower cervical joint inflammation, I'd pop the ice pack at a diagonal onto the side of the neck. With an ice pack this size, you can wrap the ice pack around the whole neck so you really affect the area. If we're looking at an upper cervical joint inflammation, again, like I said, right up onto the base of the skull, the top of the neck there, and again, same process, making sure we're getting onto the side of the neck, or we can, if you've got a small ice pack, just at a diagonal, so we're into this region here. So now I'm going to show you a quick and effective stretch for the trapezius muscle. So what Florence is going to start by doing is tucking her left hand underneath the table. So if you're sitting in a chair at home, you can do this as well, just tuck your left hand underneath the chair. This just prevents the left shoulder from rising while we do the stretch, okay? So what you're going to do now is just bring her head into a neutral position, tucking her chin in slightly, keeping her head up nice and straight. Her right hand's going to come overhead and contact her left ear. So what you're going to do now is bring the stretch into a right side bend. We're going to hold this around 30 seconds, but every 10 seconds we're going to change the movement slightly. So say we've done 10 seconds, she's now going to bring the head into a slight bit of flexion, hold that for 10 seconds. After 10 seconds, she's going to bring in a little bit of rotation to the stretch. Okay, and I'll bring it up back up to neutral, okay? So we generally do this both sides, but if you're still in quite the acute phase of a facet inflammation, generally what I do is just stretch away from the side of pain at the moment. After about a couple of days of ice in the area, then start introducing the stretch both sides to trying to keep it nice and neutral. You can repeat this a couple of times each side if you prefer as well, if there's no pain on the stretch. Okay, so what we're going to do now is just talk you through a little bit of a range of movement exercise for the neck. So what Flo's going to do is just put two fingers onto her chin. She's going to again bring her neck into a nice neutral position, tucking her chin in slightly, and she's going to bring her neck into rotation both directions. She's going to take it to the end range, not trying to push it through, but just take it there, hold it slightly, and she's going to repeat to the other direction. Again, if we're still in the acute phase of the flare up at the moment, we don't want to push the rotation towards the side of pain too far. Just take it where it's comfortable, hold it there, and take it opposite direction. We generally repeat this 10 to 15 times. If you have a round spiky ball like this at home, or if you have a tennis ball, or cricket ball, or any sort of dog's toy that you can use, you can basically use it to do a bit of self-massage. What I'm going to do is just give this a flow now. And what she's going to do is demonstrating, do a little bit of massage into a left trapezius. So she's basically putting a little bit of pressure onto the ball and rolling it around the trapezius muscle. You can work this up into the neck as well, or if you want a little bit more pressure, what you can actually do is rest the ball. So I'm going to take that for your flow. So you can rest the ball against the wall. So you measure my hands the ball. Flow will then lean back slightly with a little bit of pressure onto the ball, and then she'll just roll slightly side to side and work into that trapezius muscle. You can also lower that down slightly. So if she was again resting against the wall, she'll place that slightly in between the shoulder blade and the spine. And again, my hand is the wall here. She can roll up and down, or again slightly side to side to get a little bit of friction into that muscle. And again, it works quite nicely to really try and loosen up the muscles and any sort of myofascial restrictions in that area really loosened off quite nicely. So this is an exercise to stretch out the top joints in the neck, and also the suboccipital muscles. They're muscles that create the tension type headaches, and they basically attach the top of the neck to the base of the skull. So we want you laying in a flat position like this with your knees up so it protects the lower back. We're going to keep the back of your head in contact with the pillow at all times. And what Florence wants to do now is just retract, so pull back the chin. You can see the action she's making here, but you're keeping the contact with her head onto the pillow, okay? So we're not bringing the head forward as we do that. She's going to hold that around 15 seconds and then relax for 15 seconds. She's going to repeat that 3 times. If you're not feeling a stretch while you're doing this, you can add in a little bit of an extra stretch by placing one hand. So Flo's going to demonstrate with her left hand here. She's going to tuck it behind the back of her head. Again, you want full contact of the head onto the pillow. Don't lift the head at any time. With the other hand, she's going to place 2 fingers onto her chin, and she's going to add a little bit of extra pressure with them 2 fingers. And with the other hand, she's going to make an upward movement. So if I demonstrate here, it's going to be a movement, so she lifts up and pushes in with her 2 fingers. It creates an extra stretch, and again she can hold that for 15 seconds and relax 15 seconds and repeat that 3 times and relax. So this is a muscle release technique. So I'm going to use a little spiky ball. If you don't have this at home, you can use a tennis ball as an alternative. When you're doing this technique, it's quite useful to lay flat onto your back, keeping again your knees up to support your lower back. Where we want to place this is between the shoulder blades and the spine. If we can, do the upper part of the muscle because obviously we want the muscles related to the neck to be affected. I'm just going to roll Florence over slightly. I'm going to place that between the shoulder blades. I'm going to feel that there. I'm going to place that into the right position. She's going to roll back onto it, and she wants to put a little bit of pressure down, because obviously we need to put enough pressure down for it to be effective. With her right arm now, what she's going to do is bring that up round by her ear, and she's going to bring it round in front of her face, down past her body, and then back down to her side. She's going to repeat this action 5 times. I'm just going to speed up the process here, and we're going to reverse the picture now. She's going to do the 5 times the other direction. Again, keeping pressure down onto that ball. And relax there. So once she's in total done the 10 reps, she can relax for 15 seconds and repeat that 2 more times. So now I'm going to give an exercise to stretch and strengthen the trapezius muscle. So what I'm going to use is a resistance band. I'm going to use the red colour because we want quite a firm resistance on the band to get a good stretch. So what I'm going to get Flo to do, I'm going to get her to hold onto each end of the band. I'm going to hold onto that Flo. And she's going to place one foot, I'm just going to hold it for a little bit of support. She's going to place one foot to the centre of the band and push that down to the ground. And stand up into a nice neutral position, keeping that chin tucked in and the shoulders back. If you want a greater resistance on the band, either you can move up to a different colour, or you can just wrap the bands once around your hands. Just like that. Perfect. Okay, from here, what Florence is going to do is squeeze her shoulders up towards her ears. It's called a shrug. We're going to hold that for 5 seconds. As she relaxes, she's going to let the bands pull her shoulders down, keeping her shoulders nice and back in a neutral position. Again, holding that for 5 seconds, and again repeating the shrug, up for 5 seconds, and relax, and again for 5 seconds. And we're going to repeat that 10 times. So as I mentioned earlier, one of the causes of neck pain is bad posture. So I'm just going to get Florence to turn to the side here, and she's going to demonstrate a bad posture sitting in a desk chair. So as well as putting stress into the upper neck, she's also protracting her shoulders. So her shoulders are being pulled forwards and her pec muscles are tightening up. So it's quite important to stretch out the pec muscles. So what she's going to do now is just demonstrate a pec stretch for you. I'm going to demonstrate being the door frame or wall that she can push resistance against. So if you just place your arm onto my thing. She's going to step forwards with her left leg. She's going to bring her body weight through and put a pressure onto my arm. Here she should feel a stretch into the pec, around about the mid fibres. If she wanted to stretch the lower fibres, she'd bring her arm slightly higher. If she wanted to stretch the upper fibres, she'd bring her arm lower. She'd hold this stretch again for about 30 seconds and repeat both sides. If she wanted to increase the stretch, what she can do is use a straight arm to perform the stretch. So earlier on, I mentioned how important it is to stretch out the pec muscles, especially when you have a hunched position like Florence has demonstrated. But it's equally as important to strengthen the rhomboid muscles. So we're going to do this by using a resistance band. So what Florence is going to do now, she's going to hold either end of the band, like so. She's going to hook that over the door handle and try to get the band at equal lengths either side. She's going to stand face on, bring her elbows into her side, and then she's going to bring her elbows backwards so her hand comes towards her waist. She's going to hold slightly at the end range and then relax and let her arms come forwards again. She's going to repeat this 10 to 15 times, okay? So she's going to demonstrate just a few reps here, okay, and relax. So after doing the first set with the elbows by the side, what we're going to do then is lift the elbows slightly out to the side. Be careful if you have a shoulder injury at all when you're doing this, okay? But what you're going to do, the same technique, shoulders slightly elevated, but again, bring the elbows back, squeezing the shoulder blades at the top. So again, relax. As you bring them back, again, really squeezing the top and hold that slightly, and then relax. And again, she's going to do this 10 to 15 times, and we're going to do this a set of 3. So if you are suffering neck pain, there's a few tips I'd give. First of all, if you're working in a desk-based job, please speak to your manager about having a desk assessment done, as it's vital that you're sitting in the correct position to eliminate any increased stress on any of the joints or any muscles around the joints in the neck that may flare up and cause pain. Secondly, if you're working in a job where you're looking up a lot of the time of the day, such as painters and decorators or plasterers, please have regular breaks, say like every hour and a half, stretch out the upper neck, try and loosen up them joints again. If there is any irritation in the joints in the evening, pop a nice pack on it just to prevent a flare up from happening. But the third thing I just wanted to touch on was disc prolapses. So cervical disc prolapses in clinic, we treat in clinic mild to moderate disc prolapse very successfully alongside exercises and stretches we've just shown. If you're suffering with more severe symptoms such as muscle weakness or wasting into the arm, it may be important to contact your GP regarding anti-inflammatory medication or pain relief alongside our treatments to have the best effect. If you're not sure what type of symptoms you're suffering with your neck pain, please give us a call at the clinic and we can do a telephone consultation to try and discuss the best approach for you. Thank you very much guys for watching our video. I hope it's been useful. We'll be putting another video up later in the week on lower back pain, so please tune in for that. In the meantime, take care and stay safe.